Hi, I'm Dr. Brent with the Family Chiropractic Centre in Guelph, and today we're going to talk about shoulder rehabilitation. So, to begin with, you shouldn't have any shoulder pain for you to do any rehabilitation. So, if your shoulder's clicking, popping, locking, it's not tracking properly, these exercises are not for you. You need to get the shoulder adjusted or assessed by your chiropractor. Just make sure you have good full function before you do it at this point. Shouldn't have any pain, shouldn't be tender to touch at any point. The tissue integrity has to be high enough that it can withstand the mild stress that you're going to put on it, and then your body, with proper nerve supply from your adjustment, obviously, will allow your tissues under these exercises to adapt. So just anything I'm going to show you today, if it hurts while you're doing it, stop. Don't push through the pain. That's not at all what this is. But what we're going to do is show you how to do some exercises, tubing, stretching, range of motion exercises to help stabilize and strengthen your shoulder. So before we get into the strengthening, stretching your shoulders from a beginning standpoint is really important. You want to make sure that you have good balance around the shoulder. Some patients come in and maybe they're kind of recovering from frozen shoulder, whatnot. We want to work on the range. Maybe they can't even raise their arms up just yet. So what I often have people begin with is what's called a wall walk. So what you actually go over to the wall, touch it with your fingers, and use your fingers to climb up the wall slowly. It helps you get that full range. When you get to as high as you can go, step closer and closer to the wall until you touch your armpit sort of comes close to the wall, your side comes close to the wall, and then just slide your arm down. And you can do that up and down a few times to just help keep the range up. So that's, from a mobility standpoint, something you can do. The other thing that's good, if you're just getting started before you actually do this rehab, there's something where you can actually just take a can of soup or a small hand weight, bend forward, stabilize yourself, and just do circles with your shoulder. You can do crosses, swinging back and forth. It's a very easy way to begin strengthening and rehabilitating your shoulder before we get into the tubing exercises. So you just kind of support yourself, hang down, big circles in one direction, holding the small weight. You can begin without a weight if you want and move into a small hand weight or a soup can. That's literally what they're called, soup can exercises. Or maybe Codman, you might have heard that term. You can swing your arms back and forth and across. Once you've done those, once you've gotten to the point where you have the mobility, you can put your hand over your head without any clicking, popping, or any weakness. And once you've got the mobility, you can actually move into some stretching exercises. Stretching out the front and back of the shoulders is kind of key. So you can sort of take a door jamb, put your elbow at shoulder height, and just turn into the wall or into the corner of the door, and just hold that for 30 seconds to a minute. Okay. The higher you go, you'll work sort of different fibers, so you can actually put your elbow above your shoulder and turn in that way. You can put it below your shoulder and turn in that way. And then you can also bring your butt, that'll work all the muscles at the front. To work the muscles at the back, you can pull your arm over and pull it into your chest. Again, hold that for 30 seconds to a minute. Stop if it bothers you. You can bring it a little lower if you want, but that'll help mobilize the shoulders. As far as strengthening the muscles, really simple. You don't have to have a gym membership. Just some rubber tubing is all you need. You can buy this online. You can buy it at a fitness store. And literally all you need to do is attach it to a doorknob. So this is stuff you can do at home. So I'm going to just attach it here. And we want to work all the muscles. We want to work at the front of the shoulder. Like this is called the rotator cuff. So the deltoid muscle at the top here. So the anterior deltoid, posterior, medial, and then there's internal, external rotators. So you always want to keep the tension relatively tight here. So I'm just going to work on the back of my shoulder, the posterior deltoid. So you want to just tighten up so you get some resistance to begin with. And you're going to keep your arms straight, and you're going to pull all the way back, hold it for a second, and come forward again. So that was maybe a little too loose. We'll try it again. Tight. I should feel a little resistance at the back and forward. Hold for a second and back. So you're going to feel at the back of your shoulder a little bit of a burn there. And you want to do this maybe 15, 20 times with each area, just kind of pausing for a second at the end. It's going to work the back of my shoulder. To work the front of my shoulder, I'm just going to turn around, keep it attached just how it is. And sometimes you have to step a little closer or loosen the slack off. Different muscles are going to have different strengths. You're going to take it from your side, straight forward. It's going to work the front of my shoulder. And again, try and do that 15 or 20 times. You can rest, and you can do maybe 3 cycles of this. So each would have like 15 to 20 repetitions. So it's going to work the front of the shoulder, the anterior deltoid. And then the top of my shoulder, I'm going to come all the way over here. I'm not going to come above my shoulder, and I want to keep my thumb up. So you can try this little test. If you're standing, you put your thumbs down, you can only raise your hands so high. But if your thumbs are up, you can put it right over your head. So you don't want to pinch the tendons in your shoulder by having your thumbs down when you do this one. So just keep your thumbs up, and that'll avoid irritating, damaging those tissues. So again, you're going to bring this right across your body. Start sort of at waist height. You're going to bring it across. Keep the thumb up there and back. Across and back. It's going to work the top or the medial deltoid. Okay, so this is going to sort of give you strength through the entire sort of superior part of your shoulder. Now you want to work on the internal external rotators, the muscles that do this with your shoulder. They're smaller muscles, but what you want to do is same sort of thing. You're going to grab it nice and tight, and you're going to start kind of across your body, and you're just going to rotate over this way. It should be some tension to begin with here. Rotate off to the side. Keep your elbow tight to your side. And again, get a tension, and sometimes there's different band tensions you can get. Get a tension that you can do this 15 to 20 times. If you can't do it 5 or 10 times, it's too strong a band. It's going to work the external rotators. Last one, you're going to turn your body this way, and you're going to just bring it from away from your body back into your chest. Now, it might be hard to see, I'll just turn a bit, but you want to kind of do the opposite movement. So that's going to take you some time to get through 15 to 20 of those, but that's going to target all the areas of your shoulder, and then obviously you could switch to the other shoulder. Even if you have just one shoulder that's weak, I would encourage you to do this on both shoulders. You don't want to have a muscle imbalance. And if you do that, and this is something because it's tubing, it's not weighted, you can literally do it every day. Obviously stop if you get a flare-up. If there's any questions that you have, ask your doctor. Make sure that you've checked with them before you start doing this, because as I said, if your shoulder's not tracking properly, if it's clicking, locking, it's going to make things worse. Don't push through pain. Do it consistently. Write down what you've done, tracking it. If you find that you get to the point where you can do 20, no problem, try a heavier band. After the bands, then you can work into some weights. But this is a good basis to start with, pretty much for anyone. And leave any comments you have in the comments section. If you haven't yet subscribed to the channel, go ahead and do that. And hopefully this will give you a basis that you can rehabilitate your shoulders, give you some more strength, and move you forward with your health. I'm Dr. Brent. Make it a great day.